Greetings. My name is Dr. Erica Daniels, and I am an assistant professor of counseling at Evangel University within the online graduate counseling program. I am a licensed professional school counselor and a nationally certified counselor. This is the second module of a six-module series on providing supervision to practicum and internship students at Evangel University. Each module will cover a different topic relevant to site supervision. The modules can be watched individually based on supervisor need or watched all together as an entire unit. In this module, we will discuss the roles and responsibilities of both the supervisor and the supervisee. There are three videos within this module. The first video is on the supervisor's role. Let's begin. It is important that we consider what the supervisor's role is in providing support to the supervisee. Ways that you are able to provide support to the supervisee are through navigating the placement site, ensuring that the supervisee or the intern or practicum student is familiar with the placement site, knows who to talk to and who to contact related to any concerns or issues, and just have an overall feeling of comfort and understanding the culture and climate of the placement site. You can also provide support to the supervisee through providing feedback. We've talked about this several times already so far within the modules, and you'll hear more about it later in subsequent models as well. But constantly providing ongoing feedback is important to the support to the supervisee. Also helping the supervisee to understand policies and practices. What are those things that are done within your agency or practice or within the school setting to ensure that the supervisee is familiar with those policies and practices and knows what their role is when it comes to reporting or sharing information. It's also important to support the supervisee through collaboration with other staff members. Part of navigating the placement site is also introducing them and orienting them to the organization or to the site, but also making sure that they know the staff members and their level of role within the organization or within the school, just to make sure that they know how to collaborate and in what circumstances they are able to collaborate with other staff members. And lastly, you can support the supervisee through weekly supervision meetings. This is a requirement that you meet with your supervisor weekly at a set scheduled time in order to have 1 hour supervisory meetings where you are able to discuss concerns, provide feedback, do case consultation, and also offer feedback and support to the supervisee. We do recognize that in some instances, having weekly meetings can be challenging, but it's important that you plan ahead with your supervisee in order to make these meetings happen. Additionally, in terms of the supervisor's role, there are some ethical considerations that you must pay critical attention to. While we recognize that all ethical standards are important and are to be upheld within the supervisor-supervisee relationship and the work that you do with your clients and students, we want to highlight just a few to ensure that these are of concern for you and your role with your supervisee. One, competency. Two, we'll talk about boundaries. Three, we'll address issues of transference and countertransference. Four, multicultural concerns. Five, evaluation. And six, confidentiality. To ensure competence, we want to make sure that supervisors are trained appropriately, have the appropriate credentials, and the appropriate clinical experience. In training, site supervisors must receive training in supervision, hence your participation in these modules, these supervision training modules, but you can also take a course or engage in any other type of workshop or training related to providing supervision. This is an ethical requirement for anyone who provides supervision. It is also necessary for counselors to be competent in particular methods or approaches that they use in counseling. For example, if you're going to use a particular approach within practice and the intern or the supervisee is encouraged or interested in also utilizing that particular approach, it is important that you're trained to do so. An example of that might be EMDR as a therapeutic approach. There is specific training that one must engage in order to practice using EMDR. So you want to make sure that if you're going to demonstrate that for your intern or for your supervisee, or even utilize that with a client, that you have been trained and that you would encourage your intern or supervisee to be trained as well. For credentials, site supervisors must have and maintain relevant credentials or licensure in counseling. For clinical mental health counselors, they should be licensed through their state. School counselors should also be licensed or credentials through their state, depending upon which state in which they work. And those credentialing or licensure requirements can look different from state to state. For clinical experience, site supervisors must have a relevant number of years of clinical experience. For Evangel University, clinical mental health site supervisors should have a minimum of 5 years of experience. Similarly, for school counseling site supervisors, they must also have a minimum of 5 years of clinical experience. Let's talk about multicultural competency. As supervisors, it is your responsibility to develop and maintain your multicultural competency as well as cultural humility, to engage in this climate of reflection and demonstration of your multicultural competency skills for your supervisee. So you are to assess your level of cultural competency regularly and to challenge yourself to ensure that you are providing culturally competent care and support to the clients that you serve, and also within the supervisory relationship with your supervisee. Secondly, you also want to ensure that you're creating a climate of honesty. It's important that your supervisee is able to approach you and to engage you with any concerns or feedback that may be important or relevant to the supervisory relationship and their work with clients or students. Also, it is important that you broach issues related to cultural identities. Whether your intern or supervisee reflects a different cultural identity than yours, or whether the supervisee's clients or students reflect cultural identities that is different from theirs, it is important that you directly and intentionally engage in this conversation with the supervisee. Oftentimes, the supervisee may not raise those issues. So as a supervisor, you are responsible for engaging in those conversations or initiating those conversations with the supervisee. Also, it's important to discuss managing boundaries. Within managing boundaries, there are a couple of things to remember. As noted in the Code of Ethics for ACA, the supervisory relationship can be very complex, and supervisors are responsible for creating and maintaining appropriate boundaries with their supervisees. Several things to remember include being able to assess for dual relationships, and then also assessing for boundary violations between the client and the supervisee, or the student and the supervisee. So supervisors should clearly define and maintain ethical professionalism and social relationship boundaries with their supervisee. They should be aware of the power differential and the supervisee's vulnerability to undue influence and coercion. Supervisors should not engage in social contact or interaction that would compromise the supervisor-supervisee relationship, and dual relationship with supervisees that might impair the supervisor's objectivity and professional judgment should be avoided, and or the supervisory relationship can be terminated. Supervisors do not engage in sexual relationships with supervisees and do not subject them to sexual harassment. Supervisees are required to report any violations mentioned above to the field coordinator or university official here at Evangel University. It is also noted that supervisors should not establish a psychotherapeutic relationship as a substitute for supervision. As we talked about in Module 1, the difference between teaching, counseling, and consulting. It is important that you remember those distinctions when engaging in a supervisory relationship. Personal issues should not be addressed in supervision, only in terms of the impact that those issues may have on clients or students and their professional functioning. And if a student does require counseling or request counseling, supervisors should provide them with a list of acceptable referrals or request that they seek referrals through his or her faculty supervisor. Evaluation and gatekeeping is another important aspect that we must remember as it relates to the supervisor's role. It is important to note that supervisors must assess for growth and skill development. As mentioned in Module 1, Supervision is for the professional growth and the development of skill and competency for supervisees. So, as a supervisor, you are to intentionally and constantly assess for growth and skill development, whether that is through formative evaluations or summative evaluations. Providing specific and ongoing feedback is also important to this process of evaluation and gatekeeping. While some of this feedback may not be formally submitted to the faculty supervisor or to the university, providing that feedback to your supervisee is going to be so critically important to their growth and development of the skills and competency related to counseling. Also, gatekeeping is an ethical professional obligation. We are, as counselors, are ethically obligated to engage in this process of gatekeeping to ensure the safety and well-being of the clients and students in which we serve. Issues of countertransference and transference is another aspect of responsibility for the supervisor. Identifying when the supervisee is engaging in transference is important. Part of those weekly supervisory experiences, as well as case consultation, allows you to identify if there is transference occurring between the supervisee and their client. Assisting the supervisee with processing and managing client transference is, again, an important part of that process. So, as a role of the supervisor, when you have identified instances of transference within the client and within the supervisee, you can assist them with processing and working through that. And then also being able to determine when these issues require personal therapy for the supervisee. As mentioned just before, related to relationships or when the supervisee or intern requires or requests personal counseling, it is your ethical responsibility to determine if issues of transference and countertransference are creating impairment within the supervisee that may require personal therapy. Lastly, it is important to remember the importance of confidentiality. Confidentiality on behalf of the supervisee and their client or student, but also confidentiality between the supervisor and the supervisee. Supervisors should discuss with a supervisee confidentiality regularly to protect the supervisory relationship and the therapeutic relationship. Students have a responsibility with regard to confidentiality as well as the supervisor. It is the supervisor's responsibility to ensure that the student is maintaining appropriate levels of confidentiality and to respond accordingly when there has been a breach of confidentiality, whether it is a required breach of confidentiality or an unintentional breach of confidentiality or an intentional breach of confidentiality that may jeopardize the client and the supervisee's relationship. This concludes the information presented in Module 2, Video